Okay, so here we will talk about central nervous system infections. And just in general, in some cases, the central nervous system is going to be a direct target of an infection, and others it's going to be a secondary target. So you start with a lung infection, and then you get dissemination of the disease, such as tuberculosis, and then it can enter the central nervous system, the pathogen, and cause disease in the central nervous system. Now, diseases of the central nervous system can be caused by many different pathogens. We have bacteria infections, viral infections, fungal infections, parasitic infections, as well as our infectious prions, or proteins. Now, in general, your CNS is going to be protected. We have a blood-brain barrier that does not allow a lot of things into and out of your brain. So your central nervous system has your spinal meninges as well as your cranial meninges. And so meningitis is, of course, an infection of the meninges. You also have your subencrinoid space, which is going to contain the cerebrospinal fluid. And this is the fluid that your blood-brain barrier is going to protect from things entering. Because once things get into the cerebrospinal fluid, they can have access to many regions of your brain. Now, in your central nervous system, a few things of note. There is no room for swelling. And so anytime you have inflammation, you're going to get swelling. And so inflammation is one of the first and most formidable responses to an infection, and it's always going to lead to swelling. So what that means is you want to prevent inflammation. Now you can have vasogenic edema, which is going to be caused by inflammatory response in the subencrinoid space. And you can also have cytotoxic edema. And this is going to be swelling from toxic substances that are going to be produced by bacteria and neutrophil invasion. Now, your infections can also affect your brain function through things like acidosis, and so lowering your pH is, of course, going to affect profoundly the ability of your enzymes to function. Hypoxia, and destruction of neurons. So in all of these cases, you're going to have an effect on the ability of the brain to function. Now, the effects of the infection may be profound and irreversible. In addition, your blood-brain barrier makes it difficult to treat. You have to design antibiotics and antivirals, anti-inflammatories that can actually get across that blood-brain barrier. So some common pathogens and their way of getting into the central nervous system are going to be variable. Now, some organisms can enter the blood through this actual cerebrospinal fluid, and this is going to lead to meningitis, so that's where the meninges are. And some infections in the sinuses and your mastoid air spaces can cause erosion of the skull bone, and that's how some of your amoeboid parasitic parasites get through. And then these are going to cause abscesses and are going to enter the brain proper. But most central nervous system infections, again, are going to result from the passage of pathogens across the blood-brain barrier. And they can do this by many mechanisms. Okay, so now the central nervous system is obviously going to be made of the brain and the spinal cord, and the infections can be caused by your normal flora bacteria. They can be caused by pathogens acquired at different sites. And this is such as the GI tract or birthing and giving birth to a baby, contamination of shunts. So again, most pathogens are going to enter somewhere else and find their way to the central nervous system with some exceptions. So our common bacteria meningitis are going to be caused by Haemophilus influenza. In the United States, a vaccine is available, and so this is no longer a major cause of meningitis. We have Neisseria meningitis, strep pneumonia, Listeria monocytogenes, and Staphylococcus that are all going to be common causes of bacteria and meningitis. Now, of note, group B Streptococcus and E. coli are often going to be acquired during birthing, the birthing process, the transmission of the pathogens from the mother to the child in the process of birth. And so these two groups are normal flora pathogens that get passed most commonly to a newborn. Now, some other common pathogens, or not so common pathogens, are going to be our deep fungal mycoses, such as Cryptococcus and Coccidioides. We also have some viruses that are going to be commonly cause CNS infections. Our enteroviruses, of which polio is a member. We also have herpes simplex viruses. These are going to love to hang out in nerves. We have HIV, which HIV during acute infection is going to find its way to the central nervous system. Typically, it does not cause disease in the central nervous system until someone is progressing to AIDS, until you get your loss of CD4 count. Epstein-Barr virus can find its way into the central nervous system, and we have some very severe arthropod-borne viruses, equine encephalitis, for example, St. Louis encephalitis, and these can also be important viral causes of acute central nervous system infections. Now, as far as how they get in, there are two different sort of ways. We have occult, which means you're going to get infected of our mononuclear phagocytic cells. So these are our macrophages, for example. And then our macrophages will travel to the central nervous system and will carry with it that infection and bring the infection into across the blood-brain barrier, for example, and into the brain. There are also overt. Overt means that you have complications from other infections. So again, in these cases, you're going to start at another site and get dissemination. And then the pathogen is going to find its way into the central nervous system. Now, interneural pathways directly are the least common route, with exceptions by rabies. Rabies is going to use peripheral sensory nerves for its infection, and herpes virus uses the trigeminal nerve system. Another thing to note is our tetanus and botulinum. These are going to be exotoxins. And so because they're an exotoxin, the pathogens, the actual bacteria, are replicating somewhere else. So in the case of botulinum, they're going to be replicating in the gut. In case of tetanus, it's going to be replicating in your respiratory system, but they're going to release their exotoxins that have affinity for the central nervous system tissues. And so in the case of tetanus and botulinum, antibiotic therapy is not usually used once the exotoxin's been produced. You really need some antitoxin therapies instead. Okay, so now with respect to our bacteria and fungal infections, there are some general treatments. You are going to require aggressive treatments for bacteria and fungal because they're very invasive and they cause a lot of destruction very quickly. In addition, it's hard for our immune system to get them under control without antibiotics in other locations of our body, such as lungs. And so what that means is our bodies are also going to have trouble getting rid of them in places like our central nervous system. Now, our treatment is going to depend. We're going to have a short treatment if it's going to be uncomplicated. The immune status of the person has a lot to do with complications. If you have a chronic infection with Mycobacterium tuberculosis and you're getting dissemination into the central nervous system, that means you're having something else going on with the patient, likely that they're also immune compromised for some reason. Maybe they have an HIV co-infection, for example. And so individuals are going to have to be treated much longer in the cases of caused by Mycobacterium tuberculosis, for example. Fungal infections, again, are very invasive. And again, if you have a disseminated fungal infection to the central nervous system, that is another indication that you have an immune-compromised person. And so you're going to have to treat these individuals probably for years as well. Another important side note here is that for a virus infection, it's mostly going to be supportive care, so our immune system can control virus infections. Most people who have encephalitis caused by a virus will get cured from that with minimal side effects. However, some viruses, of course, just like a bacteria or a fungus, can cause permanent damage. But for viruses, the treatment is only supportive. So do you have meningitis or do you have encephalitis? So there are a few terms associated with these diseases. Meningitis is the infection of the meninges, which one I just talked about before. Those were those membranes that surrounded the brain and spinal cord. Encephalitis is an infection of the brain itself. And so that's going to be beyond the meninges. You have myelitis is going to be inflammation of the spinal cord. Encephalomyelitis is going to be both brain and spinal cord are involved. So what are some of the differences between meningitis and encephalitis as far as symptoms? Well, you have with meningitis a sudden fever. You also have a fever associated with encephalitis, but it could be a little bit more progressive rather than just sudden onset. You're going to have severe headaches associated with meningitis. And then encephalitis can cause seizures. It's infecting the brain proper. Associated also with meningitis would be nausea, vomiting, double vision, drowsiness, a sensitivity to a bright light, and a stiff neck. Now for encephalitis, you have disorientation, confusion, a change in behavior, grouchy, angry, those type of things. And so those are some of the differences between the hallmark signs of each. Now with respect to meningitis, we're going to have a broad category of infections, and this is again the fluid surrounding the spinal cord and the brain. This is going to be most commonly caused by a virus or a bacteria. And of course, it's important to understand which is causing the meningitis. You would treat a bacteria with an antibiotic. You would not be treating a virus. You'd be giving supportive. And so, in addition, for bacteria, it's important to know what type of bacteria is causing this, because the antibiotics used could be different depending on the bacteria that is causing the infection. Bacterial meningitis is going to be more severe than viral meningitis, so it has to be treated much more aggressively. You can lead to brain damage, hearing loss, learning disabilities, And again, it's important to understand which bacteria is causing this. Now, bacteria are also going to cause purulent meningitis. And purulent means, of course, pus. So this is associated with bacteria. And so this is also going to be characterized by fever, irritability, all those symptoms or signs that we just talked about as well. Chronic meningitis is going to be caused primarily by Mycobacterium tuberculosis, fungus, or protozoans. And of course, it's important to understand which one it is because treatments can be different. And remember that TB and fungus goes back to immune status of the host. But not parasites. Parasites can infect healthy people just as easily. Now, viral meningitis is going to be less severe than our bacterial meningitis. 90% are going to be caused by enteroviruses. And of course, enteroviruses have polio as one of their more famous viruses, but they're also going to be in a Coxsackie virus or echoviruses are also in the enteroviruses group, and they are a more common cause for your viral meningitis. Another side note is that your herpes virus and mumps virus can also cause meningitis. Now, of course, your meningitis is rarely fatal if it is caused by a viral infection, but it also goes back to if the person has a competent immune system to clear that infection. And remember, the symptoms are going to be a decreased appetite. You can have with viral meningitis nausea and vomiting, so that is a symptom of meningitis, not encephalitis. Because it's a virus, it can cause seizures, stiff neck, etc. So now encephalitis is going to be, again, infection of the brain. So for encephalitis, remember meningitis is an infection of the meninges surrounding the brain, but encephalitis is actual infection of the brain. So this is going to result in seizures, sometimes paralysis, and it can have permanent damage. You can have defective mental faculties. And again, this is not a problem within the meninges, but within the actual nervous tissue. Now, viral encephalitis are going to be caused again by different types of viruses that can cause either a subclinical infection or death. And so the infections are going to be similar to viral infections in general. Chill, fever, headaches, can lead to mental confusion and coma. Some people who survive encephalitis caused by viruses will have permanent damage to their brains, so neurologic diseases. We're going to have some arboviruses that can cause encephalitis. Eastern equine encephalitis and Western equine encephalitis are both going to have the cause associated with a horse. And so you have a bird who is the reservoir of the virus, and they're going to transmit it to the vector, arthropod vector, and then this is going to infect the horse. And people can also get infected with these viruses. So people who are going to be at risk are people who work with horses, from trainers to veterinarians to just care persons. There is also the St. Louis encephalitis, which is the most common form of arbovirus encephalitis. However, it's going to be mostly subclinical, And this is in the case where you again have a bird as a reservoir, you have a vector, and then the vector will transmit the virus to people. Now, West Nile virus is going to be an emerging encephalitis infection. Again, this is going to be transmitted by birds to a vector mosquito, and then your West Nile virus can infect different mammals, including humans. So West Nile virus is going to be, again, most cases are going to be subclinical, but some can have rapid death, especially in the elderly. And you can see this is just a map of the United States where it shows where there's a higher incidence of the West Nile virus. And again, it usually is associated with birds, so oftentimes migration of birds can have an influence on where this virus shows up.